Today we will see two practicals. One is high voltage galvanic current application. Second, Russian current application. So first I am starting with high voltage pulsed galvanic current. There are three indications for this current. One is inflammation, second is edema, third is pain. These are the three indications for this particular current. So what is inflammation? The inflammation means any area which gets silence. Any area which gets damaged will show, body automatically show four reactions. The area will become red, okay, and there will be increase in temperature, and there will be swelling, and there is trauma and pain in that particular area. When you see all these four signs, rubor, Kehler, dollar, pain, then it is called as inflammation. So any tendon, any muscle or any ligament gets inflammation, we can use this current. Any area wherever there is pain, we can use this current, and any area wherever there is edema, we can use this current. So when we are using high voltage pulsed galvanic currents, two important things. There is something called active electrode, inactive electrode. For inflammation and pain, active electrode is anode, inactive electrode is cathode. When it comes to edema, swelling, there is a increase in fluid. The time active electrode is cathode, inactive electrode is anode. Now, the common conditions, common places where you keep this particular current. So there are some common conditions which you see in your physical therapy practice, like bicipital tendonitis. You know biceps tendon, biceps muscle? The biceps tendon is here. It goes and inserts into the shoulder, okay, into the glenoid fossa, above the glenoid fossa it gets insertion. So the tendon comes here. Sometimes because of the impingement of tendon, the patient will have pain in the bicipital tendon. Inflammation because of the damage while throwing or while kicking or while carrying heavy weights. So anytime it may get damaged. So this is the place for bicipital tendon. And sometimes there is something called tennis elbow. Tennis elbow means when they play tennis or so much work if they do with hands, they get the origin of extensor tendons will get inflammation. That is on the humerus epicondyle in this region. Sometimes there is another problem called golfer's elbow. Origin of the flexors of forearm will have pain or inflammation. So like this bicipital tendonitis, tennis elbow, golfer's elbow, or sometimes carpal tunnel syndrome. The median nerve inside the tunnel of the carpal bones will get impinged and causes pain in the hand. Sometimes this is called as extensor hallucis longus tendon inflammation. It is a anatomical snuff box. In this anatomical snuff box, these two tendons will get inflamed, de Quervain's disease. This is called as. So like this, whenever there is problems with muscles and tendons because of overuse, they get inflammation, pain. Or there may be a swelling, whole hand swelling or whole feet swelling, knee pains, ankle injuries. All of these superficial conditions we can treat with high voltage pulsed galvanic current. So you have to follow the practical pro forma, like communicating with the patients, greeting with the patients, ruling out the contraindications, okay, positioning the patient comfortably, collecting the materials. What materials you require for high voltage pulsed galvanic stimulation is definitely the machine, and you need water and the electrical pads, straps, leads, okay, leads for electrical stimulation, some water or gel, okay, whatever is available. So these are the things, towels, these are the things which usually require for stimulating the patient with high voltage pulsed galvanometer. So now, before applying, we have to find out what is anode and cathode. We already know what is the procedure. This black one is cathode, the red one is anode. So if patient comes with me with bicipital tendinitis, a problem in the biceps tendon, then my anode will be on the biceps tendon, cathode will be on the opposite side. Okay, cathode will be on the opposite side. I will show you the procedure. Can you lift it? So this is the usual place where usually they will get bicipital tendinitis. Can you feel? Okay. So put water in that particular area so that the resistance for electricity will decrease. Even on the opposite side also. Put sufficient amount of water. Prepare the skin properly. Once you prepare the skin properly, then keep the electrodes into the position. So here position is opposite to opposite. Cathode and anode are opposite to each other.
So this is anode.
So anode on the pain, red anode on the pain, opposite cathode, okay, is a completing electrode. It will complete the circuit. So patient position can be sitting like this, supported or supine, or you can sit on the chair and keep the arm in a supported position. Whatever is comfortable for the patient, you can keep in that particular position, no problem. Electrotherapy, pain management, high voltage. High voltage, you have two forms. You have direct current form and you have alternating current form. Direct current will has little bit difficult for the patient to accept. Alternating current is easy for the patient to accept. So I have put alternating current. So channel 1 I have connected to the patient, so I select channel 1. Treatment time 20 minutes. Electrode selection, carbon rubber electrodes. Alternation period 10 seconds, pulse frequency 100 Hz, frequency modulation. Getting? Feel? ज़्यादा? You can feel the current?
Yes.
When you increase the more decrease.
Yes.
Okay. So when you Russian current, I will show you the contraction. This is only for pain and inflammation, so you cannot see the muscle contraction. Okay. Now I will show you different positions for different conditions. The electrode positions. For example, now this is for bicipital tendinitis. Similarly, Shabab, please study from the video. You may not get immediately. Tennis elbow. If it is the tennis elbow, on the lateral epicondyle of the elbow and on the medial epicondyle. On the lateral epicondyle, anode. Medial epicondyle, cathode. Now, if it is golfer's elbow, it is opposite. On the medial epicondyle, anode, and the lateral epicondyle, cathode. If it is Dick-Urine's disease, problem with the tendons of the thumb, then anode on the tendons, cathode on the opposite place, or here or here. The problem with big electrodes is when you are using electrodes, Shabab, this apply for all the electrotherapy equipments. When you use electrodes cannot touch each other. It cannot. Okay? If it touch, what happens?
Why? Choke. Because the same.
Electrode cannot touch each other. Not shock. It is not shock. It is patient don't get any current. If electrodes touch, the current will pass from one electrode to the other electrode without passing from the skin.
No connection.
So it won't pass through the body. So when it don't pass through the body, no effect. So the electrodes cannot touch when you apply onto the patient body. It is golden rule for any electrodes in electrotherapy. Second, how much should be the distance between two electrodes? If you keep like this, how much should be the distance between these electrodes?
Depends on the patient.
The usual rule is the width of the electrode. That much space should be there between two electrodes. The width of the electrode, if this width is 5 centimeters, the electrode width is 5 centimeters, then the distance between this electrode and this electrode should be minimum 5 centimeters. 5 centimeters. It depends upon the width of the electrode. Okay? If for example, if in the hand, if I keep like this and if I keep like this and I touch, okay, it is too narrow. It is too narrow. So that is the time I keep on the muscle and I keep little far. Okay? Because when they are near, the electric current will pass from electrode to electrode, not from the body. We want the electrical current to pass through the body. Understood?
Yes.
Okay. So this is for Dick-Urine's disease, the inflammation of the tendons.
That means when we put cathode here and anode here, it's wrong.
It is wrong. Okay? But some cases like Faraday current, okay, you can use, no problem. Or if it is too narrow, like thin hand like this, then you better keep one here, one here. Okay, of different channel, you can keep one here and another one here. Now, for the knee joint, sometimes the patient may have knee joint pain or knee ligament injuries. Most common is medial, medial knee ligament injury. Again, anode on the medial aspect of the knee, cathode on the lateral aspect of the knee. If the patient complains pain in the medial knee joint. So wherever pain, there should be anode. Ankle injury is also same. Wherever pain, there should be anode. If ankle has pain and swelling, if ankle has pain and swelling, then keep cathode. If there is a swelling, please keep cathode. Okay? When there is a swelling, increase in width, fluid, that time keep the cathode. Why? Why to keep cathode when there is a swelling? Because the edema will contain negatively charged particles. So when you keep cathode on the negatively charged particles, the negative of cathode, negative ions inside the edema will repel. When they repel, the negatively charged ions will go away from that particular area into the body. into the blood vessels and they will be circulated. That is the reason you have to keep cathode on the edema regions. Okay? They are the medium frequency currents. Russian currents usually have a frequency 2500 Hertz. They are given in 50 bursts per second with 10 milliseconds duration between each pulse burst. So, the effect of Russian currents is low frequency effect, but the current is medium frequency current because it is given in a 50 Hertz per second burst frequency. So that's why Russian currents are very good to stimulate the muscles. When you use Russian currents, here another golden rule for Russian currents. When you use Russian currents, two electrodes, anode, cathode, both of them should be on the muscle. Okay? Not like Faraday current, one on the muscle active, cathode on the muscle inactive, anode on the nerve. Not like that. Here, two electrodes should be on the muscle. Okay? So, to show you demonstration, I will choose some muscle groups and I will show you the contractions. Can you remove your shoes? Now I have chosen Russian current for strengthening the muscle. Because the big electrode size is big, I am choosing group of muscles and bigger muscles. I have chosen plantar flexors or dorsiflexors. Either of them we can stimulate. So when you stimulate dorsiflexors, rule out follow all the procedures. Communication, ruling out contraindications, indications, collecting the apparatus. Materials are same. What materials you require for high voltage pulsed galvanic current and for Russian currents are same. It is not going to change much. Only the big change is placement of the electrodes and the settings in the machine. So, if this is the muscle I want to stimulate, dorsiflexors, decrease the skin resistance by applying the water. Dorsiflexors.
This is gel or
This is water. This is water.
no problem.
No problem?
Gel.
Gel, no problem.
عمر شايف الشباب
No, I am stimulating.
شايف الشباب حوالي
Shabab, currently I am stimulating dorsiflexors. The important dorsiflexors are tibialis anterior, extensor hallucis longus, extensor digitorum longus. Okay, these are some of the important dorsiflexors and lateral group muscles. Yes. Here.
ايد
Same side, yes. You can stimulate opposite side also. When you have more electrodes, like this is 2 electrodes. If you have 4 electrodes, you want to stimulate agonist, that is dorsiflexor, antagonist, that is plantar flexor. Then you can keep 2 electrodes behind, 2 electrodes here. Okay. Currently we'll start with one group. Then I will tell you the variations. So this is for dorsiflexors. Okay. Now go to the electrotherapy. Muscle stimulation. You can see Russian stimulation. Go to the Russian stimulation. Currently I am using channel 1, 2 electrodes. Channel 1. Treatment time 20 minutes. Electrode selection I have already done. Carrier frequency 2.5 kHz. Burst frequency 50. Pulse pass ratio 1:1. Such program. You can increase ratio. That means rest more, pulse less if patient is weak. Anode and cathode should be on the muscle. Preferably, cathode should be on the motor point. For example, dorsiflexors, if this is a major motor point, like how you read in the Faraday currents, the motor point place, there should be cathode. On the same muscle, there should be the anode. For example, this is the big muscle, so I can keep a good gap between two electrodes. But if it is a small muscle, usually we don't stimulate with the Faraday currents, with the Russian currents. If it is a small muscle like biceps, then the size of the electrode should be small. It cannot be big size, the size of the electrode should be smaller one. There are different kinds of placements. This is for dorsiflexors. I will show you placements with the electrodes. So similarly, we have evertars of the foot. When there is a problem with eversion of the foot, so go to more laterally and keep the two electrodes here. This will be for evertars. For plantar flexors, two electrodes on the plantar aspect, and patient position is prone. Patient will be lying down on the stomach. For quadriceps, it is here. For hamstrings, it is on the hamstrings muscle. Again, forearm flexors here. Forearm extensors, opposite side. Biceps and flexors of the forearm here, but the size of the electrode should be decreased a little. Triceps and extensors is here. Okay, and shoulder girdle muscles. Like this, you can stimulate. Like this. Back muscles, when you want to strengthen the back muscles, directly this is the erector spinae. On the erector spinae, you can keep two electrodes. Okay, this side this side erector spinae or this side erector spinae. If you want both the sides stimulation, both the sides simultaneously, it is called bilateral stimulation of the same group. That time you have to take 4 electrodes, like dorsiflexors of this side, dorsiflexors of other side, by 2 electrodes on this dorsiflexors and 2 electrodes on the opposite leg dorsiflexors. If you want agonist and antagonist stimulation, then 2 electrodes should be on agonist like dorsiflexors, and opposite group plantar flexors, another 2 electrodes. Like flexors, extensors of the knee, same, agonist is extensor, antagonist is flexor. So 2 electrodes on each group of the muscles will stimulate the muscles and strengthen. So what should be the mode of the current, the intensity of the current, the duration of the stimulation and frequency of stimulation. When you strengthen the muscle, when you want to strengthen the muscle, the type of the current should be Russian current, that is mode. The mode of the current is Russian currents with 50 pulsed burst frequency, usually in surged mode. That is the mode of the current. Now intensity, how much current should be increased? It is dependent upon the patient, but usually when you want to strengthen the muscle, you have to see the muscle contraction. When you keep the electrodes on the muscle, you should see the movement of the body. Then only you can say it is sufficient intensity to produce the muscle contraction. That is second, about intensity. Third, duration, how much time. It is not actually the time what is set in the machine, it is dependent upon the number of sets. Usually for strengthening, you choose 30 contractions, like 1, 2, 3, or 1, 2, 3, like that, 30 contractions, 3 sets, 30, 30, 30. Between each set there should be 2 minutes gap. Between each set there should be 2 minutes gap. Like that the stimulation has to be done. You can increase the intensity, you can increase the number of contractions to increase the muscle strength. So you can increase the intensity, that means strength of the muscle contraction, or you can increase the number of muscle contractions. Both of them will increase the strength of the muscles. This is how you will progress regarding the strengthening. When to stop the treatment? Whenever you see fatigue in the muscles, that means initial contraction is full, later on contraction is like, that means the muscle is getting fatigued. When you see the fatigue in the muscles, you have to stop the treatment, give some time rest, again the next dosage. So this is how you do the duration. How much time it takes for number of muscles, number of repetitions will differ. For example, this 30, 30, 30. Other group 30, 30, 30. So it will, how much time it takes, that is the duration. But usually you can start with the 20 minutes or half an hour, then you can increase whenever it is necessary. Frequency of treatment. How many times in a week you can see? It is minimum lazam 3 times to 5 times. Every day is not required. 3 to 5 times in a week is a good option for strengthening the muscles. How many days it will take to strengthen the muscles? It will take at least 6 weeks to strengthen the muscles. More than 6 weeks. So every week 3 to 5 times, like that, more than 6 weeks will change the size of the muscle. So these are the main important points for the mode, intensity, duration and frequency of the pressure currents. Similarly, for high voltage pulsed galvanic currents, the mode of the current is high voltage pulsed galvanic current, either in direct current mode or in a alternating current mode. This is the mode. How much time? Duration? Usually it is 20 to 30 minutes. How much is the intensity? Intensity is whatever is patient comfortable. Here you don't see any muscle contraction, so you won't see any movements. So whatever is patient comfortable levels, you will keep that much intensity. Frequency, every day you can treat, alternative day also you can treat. Because it is treating the pain, inflammation and edema, you can treat it every day or you can treat it alternative day for high frequency pulsed galvanic currents. So this is about the mode, intensity, duration and frequency of the high voltage pulsed galvanic current. Any doubts?
No.
Yes.